Hi, my name is Ellen Huggins, and I'm a paramedic here at Johnston County EMS, and today I'm going to show you around one of our ambulances. Come on. Alright, I don't know if you've ever been inside an ambulance before, but we carry lots of stuff. This right here is our airway compartment. If you're having trouble breathing, nebulizers, if you have COPD or asthma or anything. Back here, we have all sorts of trauma supplies, IV supplies, even bedpans, urinals, irrigation solution, anything you could ever need or imagine. Then over here on this side, we have some IV supplies. It's one of the things that we do very common on the truck. We start IVs. We can even hang a bag of fluid if you're dehydrated, or even if you're bleeding out, like some sort of trauma or something, we can help replenish some of those fluids. On the stretcher here, you'll see that we have lots of bags. Basically everything that we carry on the truck, we also carry in the bags. It makes it really easy for us to come inside your house or your work or wherever you're at, even on the side of the road at a wreck, and bring our stuff straight to you. So this is our airway bag. It is equipped with just about every piece of airway equipment we could need, even an oxygen tank. We have airway adjuncts called OPAs. They help lift the tongue off the back of your throat. We even have things like eye gels that can go all the way into your throat, and then we can connect a bag valve mask to squeeze and then help get you air in if you're not breathing for yourself. Or in the case of like COPD or congestive heart failure, you may even need what we call a CPAP machine. All right, this is our Blackhawk bag. This is the bag with the most equipment in it. So it has just about everything you can need or imagine. We have our big intubation kit, which if you're having a lot of trouble breathing, we can use that just like a doctor at the hospital would to intubate you and then help get oxygen in you. So lots of equipment in there. And then our IV kit, just like we have in the drawer, IV kit of the same stuff we can carry right to your side. And then if an IV is not an option, we have what's called an IO drill. And you hook it up to something similar to an IV, and we can actually drill into your bone. So sometimes in cardiac arrest, or if you're really super sick, your veins were not able to start an IV. And this is another option just to help us get fluid or medications in you when you're really sick. This is our go bag, as we like to call it. We started carrying these during COVID. So they're abbreviated versions of these bags, but what's cool about these is it's the most essential items and in a wipeable surface, so we can easily clean the product. Thermometer, which comes in handy a lot in COVID. Glucometer, and then here we have IV stuff and some trauma stuff. So if we have to bandage a wound or splint something, we can start that process. Even the all-important tourniquet. So this is our monitor. In Johnston County, we carry Zoll. This is what helps us take your vital signs, from the simplest of a blood pressure to a pulse ox, to even a picture of your heart. So lots of cables and wires, blood pressure cuff. These are the EKG wires that we hook up to get that picture of your heart, and the finger probe to take your pulse ox. When patients are really sick, in cardiac arrest, or heart rate's out of control or not doing what it's supposed to, pads. Just like when you take CPR class, you put the pads and then the AED tells you when to shock. This is a little bit more advanced. We put the pads on, it actually gives us a rhythm, and then we use what we learned in paramedic school to interpret the rhythm and figure out when to shock, what rhythm to shock, and so on. So let's take a look at some of our outside compartments. This compartment can actually be accessed from the inside or the outside, whatever is the most convenient. We carry all sorts of things. So this is what's called an ACR4, and basically it is car seats for every size child you could imagine. This is our active incident bag, and it has things in here like tourniquets, dressings, even needle decompression. So if somebody is shot or stabbed, this is like the specialty kit for them. Burn kit. So anything that we would need to potentially dress or irrigate like a really bad burn, like maybe in a structure fire. This is our pediatric bag. This bag is actually kind of cool. I'll open it up for you. We have a pediatric kid. We'll take what's called a Brazo tape, and we lay it beside the kid and measure how long they are. And let's say they're a yellow kid. We'll go inside our pediatric bag. We'll pull out the yellow kit. And it is perfectly sectioned that we have ET tubes that are the perfect size, needles for IV that are the perfect size, even OPAs like we had inside the truck, but the perfect pediatric size for a kid that's yellow. And we have every color of the rainbow for however big or small your kid is. So this is what's called a kangaroo fix. We just got these not too long ago. This is perfect for that newly delivered patient. So a pregnant mother, we deliver their child in the field. How do we transport mom and baby together in the same ambulance, let them get that nurturing skin to skin time, and safely secure both mom and patient in the truck? Baby goes in here, it's got some fancy straps, hat goes on baby, and then baby can actually ride on top of mom while she's secured on the stretcher in the truck. Baby's safe, mom's safe, everybody's safe. We get everybody to the hospital, and everybody gets to stay together, which is really cool. These are also pretty new. These are what's called Carter kits. These are for those patients, maybe with an autism disorder of some kind, sensory overload, or having a really hard time dealing with the situation. We have all sorts of stress relief toys, sensory toys that may help distract you, may help you regulate, may help you calm down. We've been strictly told they're not for us. What's super cool is it actually has a weighted blanket. We even have earmuffs, even sunglasses. This is our portable suction unit. If you went into cardiac arrest inside your house or in your place of employment or even on the side of the road, we can meet you where you are and help you out. So if you're having trouble breathing, or a lot of times what's happening is there's a lot of saliva or fluid or even blood in your mouth, we can suction it out. All right, so this is our backboard compartment. So if you're like in a really bad car wreck and we need to kind of protect your spine to get you out of the vehicle and transfer to our truck, we have backboards. We have splints. So these are board splints, short, medium, and long. They come in handy for splinting different things. So short boards are really good for arms, pediatric patients. If they have a broken arm, it helps us stabilize it. It's a lot more comfortable en route to the hospital. This is one of my favorite things on the ambulance. This is what's called a stair chair. So when you're in a house and you can't walk, or walking makes whatever's going on worse, we don't want you to stand up and walk outside the house. It's gonna raise your heart rate, it's put more stress on the heart. So we can help roll you out. So it's kind of like a wheelchair. Sit on it just like a wheelchair. It rolls around just like a wheelchair. It's got some really nice straps to help secure you in. But what it also does is we can take you down the stairs. So on this side of the truck, a little bit of everything. This compartment, this shelf is a lot of our PPE. Easy access to gloves, to masks, even to gowns. Down here, we carry what we call turnout gear. It's very similar to the firefighters and what they wear. A helmet. We even have gear just like they do. This cabinet has a little bit of everything. So this is our ballistic vest. This is in case we need to go into a scene that maybe is not quite safe yet, like an active shooter incident, or has the potential to become unsafe. We even have life vests. So in case we need to help somebody who's in a pool or a pond or a lake, anywhere, large body of water. Throw rope, so again, helping somebody in water. Helmets for us. This is a KED. This would be to like help immobilize somebody similar to a backboard, but in the seated position. It slides behind them. You wrap these straps around them and it kind of keeps them in the seated position with their spine nice and straight. These are our traction splints. So this would be if somebody broke their femur. You measure it, make sure it's the right height, connect it right here, and then you kind of pull traction on it. Pulling traction actually not only stabilizes the wound, prevents it from causing further damage, but it also really relieves a lot of pain. All right, let me show you the front of the ambulance. This is what we call our CAD system, or computer-aided dispatch. So this is what allows us to have the information that you provide to the 911 dispatcher. So when you call 911, they ask you what's your location, what do you need, ambulance, fire truck, police officer, and then they send the call to us. Right here, you can kind of see where the ambulances are right now. We have a couple calls in the system. 41s on a subject fell, 91s on a chest pain, 42s en route to an MVA personal injury, 43s transporting a sick person. And then once you open the call up, we'll actually have all the answers that you gave to 911. The more answers you can give, the better the answers that you give, the better information we have, and the more prepared we are coming into the call. All right, so this is our stretcher. Here in Johnson County, we use a Stryker power load, and with just the touch of a button, it's able to go in and out of the ambulance. And then we take it to wherever you are, and with the touch of a button, it goes up and down. And then it loads back in. Just as easy as that.
Thank you.